Yes. Hello and welcome to today's webinar, Cutting Edge CME, which is a brainchild of our uh, immediate past president, Dr. Meenu Agrawal, madam. I welcome you all for today's Cutting Edge webinar. And today we have the interesting topics, that is a thin endometrium in IUI and also the intrapartum care for joyful motherhood. And I request the organizers to play the PPT so that we will start with the Ganesh Vandana, and then we will invite our president, Dr. Aarti Nimkar, madam, for the invitation for the welcome of the all delegates. So I request Prasad to please start the PPT.
Mr. Prasad. And Kanpur Society,
Yes.
along with the non-communicable disease chairman, Dr. Kanchan Sharma. So this is going to be the flow. So we have the president and secretary of both the societies, Kanpur OBGY Society as well as Aligarh OBGY Society. I can see Dr. Zehra Mohsin here from Aligarh OBGY Society, and we have our POGS, Pune Obstetric and Gynecological Society, Dr. Meenakshi Deshpande, General Secretary, and Dr. Aarti Nimkar, the current president. And we have our chief guest, Dr. Pankaj Desai, sir, and our guest of honor, Dr. Asha Bakshi, madam. So we start with Ganesh Vandana, and then we will take it forward from here.
Yes, ma'am. Yes. So, can we play a Ganesh Vandana, please? And then we will have a welcome address.
Yeah, sure.
I'll call him once. Give his welcome note address. Aarti ma'am is our president. She is a senior gynecologist practicing in Pune. Madam is a very dynamic president of our Pune Obs and Gynec Society. So I welcome Aarti ma'am for today's webinar, and I request ma'am to give her welcome address.
You are muted.
Aarti ma'am, please unmute yourself.
Yeah. Sorry. I welcome you all for this cutting edge webinar, the Meenu's brainchild, and because of her, we can meet with the present secretaries of the different societies all over the India. So this time we are meeting the Kanpur OBGY Society and Aligarh OBGY Society. So, and our chief guest is Dr. Pankaj Desai. Welcome, sir. We are very much fan of your presentations. Every time we know that Pankaj Desai is presenting something, and we attend that without fail. So, welcome, sir.
Thank you.
Yeah. And our guest of honor is Dr. Asha Bakshi, madam. And our two speakers are there. Dr. Meenu, madam, she's speaking on the thin endometrium in IVF. And Kanchan Sharma, madam, is going to talk on the intrapartum care for the joyful motherhood. And chairpersons are the president of the Kanpur OBGY Society, Dr. Kalpana Dikshit, and Reshma Madam, Secretary of the Kanpur Society. And for the second session is Dr. Meenakshi Sood from the Aligarh Society. Yeah. And Dr.
Zehra Mohsin.
Yeah. She is from Secretary Aligarh Society. So welcome you all, and I ask Kanchan to proceed ahead. Kanchan?
I think she's
Yeah.
muted and not.
Okay. Yeah, no problem.
Like me.
Yeah. Kanchan, you are muted and we cannot also see your video. If you can play the PowerPoint is with you because Mr. Prasad from BSV is not able to play and he's given it to you. Kanchan, you play it from your laptop.
I think
To begin with, I welcome our guest of honor, Dr. Asha Bakshi Madam, and our chief guest, Dr. Pankaj Desai Sir. Dr. Pankaj Desai Sir is the past president of Foxy. Very liked. His presentations are amazing. They are, they just stick with you forever. So you listen to him once and you always remember. He's a teacher of teachers. I think all students, all doctor community, OBGY community, everybody is a fan of Dr. Pankaj Desai. And we are so privileged, sir, to have you with us on this virtual forum, sir. So, sir, please, I want to listen to you and not myself talk about you. So, please go ahead, sir.
even this is my proud privilege to have पंकज सर and उनके दर्शन करके बिल्कुल धन्य वाली बात है. So, sir, warm welcome from NCD committee.
Thank you very much. Thank you very much. Honorable Dr. Minu Agarwal, Dr. Kanchan Sharma, person working very hard, who is suddenly disappearing in between, that young dynamo of this program, and also the president, honorable presidents, who I should address first, because this is a Foxy. Is this a Foxy platform?
Sir, this is a POGS program, sir.
Okay, then that is okay. The office bearers of Pune, the office bearers of Kanpur and Aligarh societies. Dr. Zehra Mohsin may not remember, but I remember her. We have met more than once. And for me, Kanpur, very fond memories. One person very distinctly close to many of us in one group in WhatsApp is Dr. Bharti Jataria, whom we respect a lot, and she means a lot. She is my everyday good morning friend. So Kanpur has as such also lots of good memories. Thank you. You have honored me. I don't give routine sort of chief guest addresses and do blah blah. No verbal diarrhea. I will just tell you a story. My age is that of a grandfather, and therefore, what does grandfather do? What are your memories of your grandparents? वो कहानियां सुनाते हैं. मैं एक कहानी कहता हूं आपको, एक कहानी सुनाता हूं, and that is based on true stories. All my you can see my blogs. They are read by more than 1 lakh people now, 1,18,000. They are all on real life stories. And the title of this story is Doctor is Upstairs. We will call him Praveen. Praveen's father was a farmer. They owned a piece of land in the village, a cow and 2 buffaloes. His parents' lives taught him all good values and good sanskars and soft skills. He got his primary schooling in his village. His brilliance was obvious right from his early school days. His father encouraged him to study further, but this was going to be a challenge. The middle and the high school was in town, about 5 kilometers away, and there was a river between the 2 villages. Getting admission to that school was not difficult. But commuting in monsoon was going to be a big problem. In other months, there was a very shallow strip of land in the flowing river. It used for walking through the river, but in the monsoon season, when the river would be flowing bank to bank, it would mean swimming through. So much was his enthusiasm to study further that walking through, swimming through, and sometimes running through didn't bother him. His father got him a bicycle. He would ride it to the river, then lift it through the water, and ride again on the other side to the bank, to the school and back. It was a similar journey back. In monsoon, therefore, it was walking through, swimming through, and sometimes running through. Thus went 6 more years. In the school-ending board exam, to a great amazement of so many, he stood 5th in the entire state. No one had heard the name of that school, which was now in news due to his achievements. He aptly lived the words of Swami Shivanand that no one has ownership rights over knowledge. Gnan par kisi ka ijara nahi hai. He was in all newspapers. A couple of days after, a white ambassador car. Most of you will be remembering this. I'm sure Aarti Madam also will remember this. That was all that was available at that time. A white ambassador car came and stood outside his home in his village. An obviously wealthy middle-aged couple stepped out and entered the house. Everyone in the village knew them because they were originally from a family that had migrated to the city, which was nearby and made good. Praveen's mother was present at that time in the house when the guests arrived. She got too nervous at the attention. Having made the guests sit on the charpoy, she rushed to send someone to fetch the father and son who were working in the field. It was vacation days. Please wait, my people are coming. She comforted the guests and hurried to prepare some tea. We have come for your son Praveen, the couple said. Oh, he is too young to be married. He wants to study. The couple laughed at her innocence. We are not for this. A relief spread on her face. What are your plans? The guests asked the boy who had returned home with his father on getting the message. I want to study and be a doctor. But the words trailed off as he squatted on the floor facing them. Wasn't the problem obvious? As they sipped the tea, the couple offered, you will study. We will stand all expenses of your education. Study as much as you want. Go abroad. Do whatever you want to do. But there is one precondition. A grimness spread on the face of the boy and his parents, not knowing what will follow. You will not forget your roots. You will return to serve your people. Oh, that? Sure, all three, the parents and the son, spoke out in unison. Then go ahead. Don't look back, was the promise-giving reply. He went to the city for a university education. Being brilliant, he got admission easily into medical college and studied single-mindedly. Never once did he forget the circumstances that had made all this possible. He joined MD Medicine and cleared the exam with flying colors. He returned to district headquarters just about 10 kilometers from his village and started his hospital there. So that his patients feel comforted, he decided to have his residence on the same premise as his hospital. He bought his house on the top floor and the ground floor was his hospital. Now here comes something very beautiful. Prominently displayed at the entrance of his hospital was a board that read, Dr. Praveen is upstairs. The patients read it and felt relieved. Oh, our doctor is in the same building upstairs. No worries now. He will run down if there is any problem. It sort of became his brand specialty that he lived upstairs, the hospital premises. He refused to marry. All this is true stories, huh? His patients were his mission and his passion. I don't have time for marriage, was his standard reply when asked. He and his patients were his only world. His fees were reasonable. His benevolence was astounding. He had a promise to keep. Don't forget your roots. The words of the kind couple incessantly echoed through his ears. Don't forget your roots, Praveen. Don't forget what you were. Praveen's name became famous in the entire district and even beyond. In local vernacular, he was known as Upparwala doctor, meaning the doctor who is upstairs. He became so well known that all used to say, if nothing cures you, God upstairs, Upparwala, or this doctor, Upparwala doctor, will cure you. He kept his knowledge up to date. He attended conferences, brought in new technology, and even went abroad to learn new and recent advances in the subject. He applied all he learned into his clinical practice and used up-to-date knowledge and skills. The modern approach was a big factor in making him so successful. Never did anyone see him getting angry at his patients. Bed availability was a huge problem at his hospital due to incessant rush. The hospital was thriving. He needed extra space. Thankfully, another hospital came up adjoining his own. He requested the doctor to share his bed space with him when required. It was a surgical hospital. The doctor agreed. On all these beds that he had rented, there used to hang a board which said reserved for the patient of Upparwala doctor, the doctor upstairs. He used to get so late in his outdoor practice that he took his time from midnight. But there used to be a common word amongst all his patients. The doctor upstairs would surely come to examine. He won't sleep without seeing his patients. Soon, he entered the 5th decade of his life. That was the time the pandemic of corona let itself loose on the world. Anyone and everyone who had a relative or a friend in life were getting engulfed in its tentacles. He took all the precautions. He got 2 doses of vaccine, but still he got entrapped himself. He got the fever and he knew that that's it. His fever did not abate and needed admission. Other physicians and doctors of his city attended to him in their hospitals. Soon his oxygenation fell. He fought valiantly, as he had done in his life, and for his patients' lives. But on the 16th day, his system failed. Corona had ruthlessly engulfed one more angel. A shocked hush fell on the town as the fateful news spread like wildfire. The doctor upstairs is no more. The doctor upstairs is no more. Upparwale doctor nahi rahe. Thousands of whom he had saved stood far away as they watched his dead body being taken for cremation. The pandemic norms had to be followed for the body disposal. But who could control the crowds? Their helplessness made them feel more vulnerable and angry. But to no avail. There was a huge outpour of emotions. Some wept, some swooned, some fainted. Adults, old men, women, children. Now, there was no one to wipe their tears. A year passed, but most of them couldn't forget him. The pandemic slowly abated. The hospital was now sold out, and a new doctor had stepped in. But many families whose lives he had repeatedly touched were not feeling a closure. They were not healed. Their emotional loss just refused to go down. Their helplessness was haunting them. Something was needed. Something had to be done. Finally, they met the new doctor who had now owned the hospital. They made a very unusual request. Thankfully, the new doctor readily accepted the request. So now, sometimes in some city, you will be able to see this if you see that where he was. So now, prominently displayed near the entrance of the hospital was his old board, reassuring him, them, and the world, giving them some solace to his patients and their relatives. Dr. Praveen is upstairs. Indeed, he had become their Uparwala doctor, their doctor upstairs in heaven. Thank you very much for this honor.
Beautiful.
God bless you. God bless you all. Thank you.
Very, very, very touching, sir. Very touching. Very
touchy
touching,
and
sir.
very
story.
emotional.
Yeah.
And it's a great learning. We all become so emotional.
Thank you.
So emotional. When I have seen you while you were chanting the story, you were having some tears in your eyes.
Yeah. And Dr. Praveen was all dear to all of us as well, sir. So, yes. Thank you. Thank you very much, sir. Thank you. And I did not mention a few things about sir. I thought let us hear his story first. Sir got a Lifetime Achievement Award for contribution to the subject and to the organization by Foxy in 2022. So that is a very, very, and as well as also he got the best publication prize in the junior category. So as a junior as well as the senior most, I think he is the best. So thank you very much, sir. Thank
Very
you for
much.
joining, sir. And
I will
so many
request
books
you
by sir,
to
so many
review this
chapters by
because
sir. so many things by
I
sir.
have a prayer. My daughter is leaving for Bangalore. Therefore, I will be seeing her off, and I have promised her that beta just wait for 5-10 minutes. I will come because
Sure, sir.
when daughters leave, fathers want to be there. So
Sure.
please pardon me.
And
My
thank
daughter
you.
is.
Even being so busy, you joined to
Thank
bless
you very
us.
much.
Thank
God
you
bless
so
you.
much.
God
You are
bless
obliged.
you. God bless you, Aarti madam. God bless you. God, the
You
two
are
Meenakshi
obliged.
madams, Kalpana Dikshit, a pleasure to see you, madam.
Thank you, sir.
After a long time. God bless you, madam. God
Thank
bless.
Thank you.
It was great to listen to you. Thank you, sir.
So, Dr. Meenakshi Deshpande,
Yes.
now we have Dr. Asha Bakshi will be joining in some time. So, we can start with the first session. So, Dr. Meenakshi Deshpande, General Secretary of Pune Obstetric and Gynecological Society, you can you can do the introduction of the first two chairpersons and then we can start the first lecture.
Okay. So thank you all. Anybody putting the PPT slide for introduction? Dr. Kanchan? First chairperson is, I think, Dr. Kalpana Dikshit.
She
Yes,
is
yes,
she's the director of Jeevani Hospital.
Yes.
She is the president of Kanpur OBGY Society, organizing secretary of WW NatCon 2023. She is the master trainer of GDM Foxy 2019. Organizing secretary again WWWCon International Conference 2018. Honorary past secretary KOGS 1718 and National Conference of OBGY UPCOG 2017. And Meenakshi, your huge program that you are going to conduct in Anandvan, also I think you can talk a little bit about it and then
And
also.
she is also organizing secretary of the program in national conference, which is going to be held in Kanpur
yes.
In Kanpur.
In
on
September
21st
21st.
September 2024.
Okay. Okay.
You are cordially invited to there.
Yeah,
Thank
you
you.
all are
Invited to the
cordially
Kanpur.
invited.
Thank you, madam. And you're looking very pretty also in your sari and nice color.
Thank you, thank you.
Yeah, welcome all the faculties and the from POGS. Being the General Secretary of POGS, I would like to welcome you all. Dr. Desai sir has just now left, I think, but Dr. Kanchan Sharma, Dr. Meenakshi Sood, Dr. Kalpana Dikshit, and and everybody who is actually all the delegates also who are listening to this webinar, and there's a lot of attendance. We have getting a good attendance for these webinars. So I welcome all the faculties and the delegates. And I would also like to let you know all that we are arranging a very good program at Anandvan in Nagpur, near Nagpur. If you know about Anandvan, there is a Baba Amte's project where cured leprosy patients stay and they are looked after by other people. And so there is an approximately public of about 3,000 people staying in that premises of Anandvan, which is near Nagpur, near Varora. And we are planning to have a ladies' gynec checkup. It will be just a screening check. And so we will just help them to identify the people, the women who require more detailed investigation about, say, CA breast
or CA ovary or CA cervix. So that is what is our aim actually, screening.
Congratulations. A wonderful program. Yeah.
Thank you, Meenakshi.
Seems
Thank
Because
you.
there are about 300 or 400 women out there who are not having any routine checkup done throughout last 10 or 14 years, whatever they are staying. So we thought we would do like that, and we would be inviting you all
Very
also
nice
to join.
initiative. Very nice
I'll
initiative.
send you the brochure on the group as soon as possible.
Yeah, all the best for
Sure,
such
sure.
a
Thank you,
wonderful
Meenu.
awareness program.
And our
Kalpana
next
madam, you can
chairperson
take
is,
over because Dr. Reshma Nigam is not there.
I
don't
think
see
so,
her.
yeah.
Uh-huh. So
So we can start with Dr. Meenu Agarwal's lecture
Yeah.
only.
yeah. So Kalpana madam, you want to?
Yeah, anybody introducing? Have they given the?
No, where is the CV? I think I don't have the CV.
It's all right. I am Dr. Meenu Agarwal, madam. I am the immediate past president of Pune OBGYN Society. And
Yes,
yes, so I shall be talking on the first topic, and the second topic, Dr. Kanchan Sharma will be taking. Actually, the person who shows the all the PPTs, he's got stuck up in his native place, and he's not getting
Okay.
to log in. That is the
Okay,
problem.
okay.
And she is for the
Uh-huh.
post of vice president.
Okay.
She is for the
Yes.
please, yeah, help her for
Done.
getting that post. I would really request from the POGS that this is our nomination for the
Done, done.
candidate.
I
Vice
remember,
President.
Dr. Veenu.
Thank you so much. Thank you, Dr. Kanchan. And Kalpana madam, I shall be talking on the management of thin endometrium.
Yes, sir.
You want to say something? Otherwise, I can
No,
start.
no, you go.
Okay. Thank you. So, all right. Okay. We got a little late in starting. So I shall be talking a little bit about thin endometrium today. I know it helps everyone. I mean, this is a topic which everybody is flustered. Suppose you're doing IUI or you're doing IVF. In both the cases, if the endometrium is not growing, so how I tell my patient that I have seed and I have soil. Even if I have a good seed, if it is not, if the soil is not
Sorry,
fertile,
Jonathan.
then we will not get the pregnancy. So when we look at the normal, the human race is a very wasteful race. So when we see, suppose we have 100 fertilization happening, out of this 100 fertilization, 30% don't implant. Okay, another 30% may implant, but patient does not come to know because it is an early pregnancy loss, right? So 60% तो यहीं चले गए. 40% में 10% can have a first trimester in miscarriage, and only live birth, or total all 3 trimester and only live birth is about 30%. So this is how a natural fertilization happens in a normal couple, right? The natural pregnancy. So out of 100 fertilization, there is only 30% live birth rate. And that is why when we talk about IVF, then we say, okay, only 60% are conceiving. Why others are not conceiving? And then we compare it to the natural cycle. We feel, oh, we are much better. We are doing better in vitro than what nature is doing in vivo for us. So we must give very, very realistic expectations to the patients, right? Suppose pregnancy nahi ho raha hai or the endometrium is not growing, what to do? So egg, sperm is one part. Uterus, if the endometrium is not growing, how can we make it better? If we don't make it better, patient has an option always to change the doctor, to change the clinic, which is again gets very uncomfortable, uneasy for the center as well as for the doctor. When we look at the endometrium, now endometrium is a highly regenerative tissue. This is the USP of endometrium, and how we can exploit it for thin endometrium, because it has good regeneration. तो इसको हम कैसे regenerate कर सकते हैं if it is not happening naturally, right? So we need a good endometrium. We also need a good endometrium receptivity. So both are required. So let us look at both the things. Abhi, even if we transfer a very good blastocyst, or in an IUI cycle, we have a very good oocyte, E2 values are good, she's ovulated very well, and we have done an IUI, but there is no pregnancy. So where is the bottleneck? Bottleneck है कि वो इम्प्लांट ही नहीं हुआ या वो फर्टिलाइज नहीं हुआ. So this is what we want to look at in the case of the endometrium. So we need to prepare a good endometrium to get a good window of implantation, and that is what will happen in an IUI cycle. तो हमको क्या क्या देखना है IUI में? One is thickness that we have to see. Only thickness is not important. We have to also look at the pattern. यानी triple line होना चाहिए. If it is thick but it is homogeneous, then our pregnancy rates will be very, very low. Second thing, you put a color Doppler, and endometrium में कितना blood supply है, sub endometrial blood flow again is very, very important. And why a woman does not conceive all through? अगर हम suppose day 5 पे हम embryo transfer कर दें, will she conceive? She will not conceive, because the endometrium is hostile for an embryo except during window of implantation. Now, successful embryo implantation depends on a close dialogue between the embryo and the endometrium. Agar endometrium thin hai, that means there are two things. Either the estrogen levels are low. Okay, that is one thing. Second thing is estrogen level theek hai. You do a serum estradiol value, it is coming 180 picogram per ml. So estrogen levels are good, but the lining is thin. That means the blood supply is not going to the endometrium. So blood ke andar estrogen hai, but it is not reaching the endometrium. That is the second thing. And the third thing is that there is damage to the basal endometrium. Blood bhi ja raha hai wahan par, but there are no receptors there to accept the estrogen. So these are the three things that we have to keep in mind. Where we see permanent damage to basal endometrium. Now, all of us are gynecologists, all of us are obstetricians as well. We must know that whenever we are doing a curettage of a obstetric, for obstetric reasons like missed abortion hai, retained placenta hai, or maybe even an MTP. So there we have to be very, very, very careful, because agar wahan par curettage hota hai, as far as possible nowadays, I think most of the centers abroad, they are not doing any curettage. You do a good ultrasound. If the patient is not bleeding, we can wait, we can manage with medical management, making sure that we are not dealing with any kind of an infection there. However, suppose she has not had any history of any DNA done, still the endometrium is thin, we must, considering our Indian circumstances, that there is a possibility that we need to exclude genital tuberculosis. So that is very, very important for us. So how do we evaluate the endometrium? Patient आया है suppose on day 13 पे, her follicle is 18 mm in size, but at that point of time when we do the ultrasound, we don't just look at the follicle, we also look at the endometrium. So endometrium, and we put a color Doppler and see what is the value of the, how is the blood supply to the endometrium. How do we measure the endometrium? So it should always be, for juniors here, it should always be from outer to outer. Okay, so at the maximum width of the endometrium. That is one thing. Second thing is how some people, other people measure. They measure from ये यहाँ से measure करते हैं and they go till here. So this is one measurement, and second measurement they take from here and they take it until here. So these are the two measurements they take, and then they add these two measurements. That is actually micro management of the problem. However, that will actually exactly give you the endometrial thickness which you need to know. Again, अगर endometrium thickness अच्छी है, suppose she has 8 millimeters and plus endometrium, you are doing an IUI for her, you may or may not get the pregnancy. However, if the endometrium thickness is low, say 5, 6, 7, it has a negative predictive value. So it is more important for the negative predictive value. Sometimes in our center, like we have a tertiary IVF center. So suppose you don't get the pregnancy, you go back. You see what was the endometrial thickness when the embryos were transferred, and they were borderline. So we know that that probably was the cause why we did not get the pregnancy. Very important again is put the color Doppler. So here you can see we put the color Doppler. So this is a good endometrium here. Again we see here this is a good endometrium. You can see the blood supply all around. Here this is okay. Here this is a poor endometrial vascularity. So again this particular patient, I would say chances of her conceiving are very low. So it has a good predictive negative predictive value. This patient, when I transfer a good embryo or I do an IUI with a good sperm count, I would say that this patient may or she does have a good chance of conceiving, but there is also a possibility sometimes she may not conceive. Again, when we look at the endometrium here, so we have grade A, grade B, and grade C. Okay, so grade A is a triple line endometrium with intervening area as hyperechoic as the anterior myometrium. B is less hyperechoic, and grade C is a homogeneous isoechoic endometrium. So let me see if I have those images here. Oh, just not there. All right. So when we do the ultrasound on day 2, suppose second day pe patient aaya, we will expect that the subendometrial blood flow hai ya nahi hai. Okay. If it is present, that means she has a good endometrial receptivity. So that is again very important that we check. Now, if the endometrial thickness is more, they say more than 13 is also not good. कि ऐसा नहीं है कि very thick is very good. So if the endometrial thickness is more than 13, here it is written 16, but there are some latest publications which are showing 13. More than that, again the pregnancy rates are low. Less than 7 millimeters, again pregnancy rates are low. Now, what do we do if the endometrial thickness हमको अच्छा नहीं मिल रहा है, we want to go for IUI? First thing is, suppose we are doing clomiphene citrate cycle, we can switch over to letrozole. I'm sure most of us over here are using letrozole already. We have given letrozole, लेकिन उसको endometrium we are not getting good endometrium. What is the next thing? Next thing is, can we add estrogen to that patient? And if we can, when to add the estrogen? Now, again, it is very important for us to understand that if we add estrogen will give a negative feedback to the HPO axis, right? And it will reduce the FSH values and it will act as an antagonist. So, estrogen should only be added when you already have a dominant follicle. Suppose you have a dominant follicle 16 millimeters today, your endometrium is 6 or 6.5. You are thinking that in 2 days' time I'm going to give her a trigger with HCG, but her endometrium is thin. You can add estrogen over here. So if you go very roughly, you can start from day 10. However, I still insist that we must do a good ultrasound, look at the size of the dominant follicle, and then add estrogen. If we add estrogen at a smaller, lower size, suppose 12 follicle, and we add estrogen, then you will not get a follicle for the IUI. So estrogen हमने ऐड किया, and we are saying कि I have added estrogen and still I am not getting a good endometrium. That means that estrogen is not reaching the endometrium. So what to do, how to manage, how to think that it is not reaching? Do the E2 values. If E2 values, now the follicle is also secreting estrogen, you are also adding estrogen. So normal mature follicle will give between 150 to 200 picogram per ml of estrogen. You have added estrogen, so the E2 values may be 340, but you find the endometrium is still thin. That means that the uterine blood flow, or there is some thing that the estrogen is not reaching the endometrium, or there are no receptors. Then of course this I can of course skip. Then what else can we do? तो एक तो estrogen दे सकते हैं, number 1. Number 2, there are some studies to say that high doses of vitamin E. So we can give up to 600 milligram daily, 400 milligram once and 200 milligram second dose. And they say that it improves the endometrial thickness. Antioxidants we are giving left, right and center, but they definitely have a role in thin endometrium. So what is the dose? 1.5 grams, the total 6 grams per day. You can start even from day 1, no problem at all, and then you can give it till the day of the trigger. Sildenafil is another thing which we can give, 25 milligram vaginally. Now you get even 75 milligram SR tablet. So they can use it vaginally. Only thing is, whenever we are giving sildenafil, tell the patient that sometimes they have headache with it. So tell her to take some Dolo or some paracetamol tablet if she gets the headache. So that has to be explained to the patient. This again improves the blood supply, and that is how it will, the transport of estrogen to the endometrium will be better. Low dose aspirin. Now, when to start low dose aspirin? There are recommendations that you can start right from day 1. आपने जिस दिन आपने letrozole start किया, you can start with 75 milligram of baby aspirin, and she can take it continuously. Even after she conceives, she can probably continue, and then maybe anti-scan and your at that point of time, your uterine artery flow, you can decide whether you want to increase the dose. Then there is something like a nitroglycerin patch. I have no experience with nitroglycerin patch, but they say that probably it could also be used to improve the uterine blood flow. Smoking, alcohol, of course, improve the BMI. These also may help to improve the vascularity of the endometrium. Then is GCSF. Now we use it a lot, especially for our IVF patients, but we can also use it for IUI patients. अब इसको कैसे use करते हैं? Suppose today her follicle size is 17, endometrium is 6.2. We have a good follicle. I have done the E2. E2 is 180, so the estrogen values are good, but locally the endometrium is not growing. So you get it as a ready-made in a syringe, in a tuberculin syringe. You take the patient to the OT, a minor OT, and just like you do an IUI, you place this GCSF. Earlier, when it came into the market, they said you use half 150 intrauterine and 150 you can give subcutaneous, but now we are using it only subcutaneous, so you can use half the dose. It is 1 ml, so just about half an ml in the uterine cavity we can give it, and then in 2 days time, in most of it does help. In many cases you will find that you have got a better endometrium. What is the other thing that you can use? You can use a PRP. So PRP, I will just explain to you how to prepare it, and that PRP also about half an ml day 10, 11, 12, 13, or a previous history of a thin endometrium. You can place it intrauterine, and after 2 days when you do the scanning, if we are lucky, we can get good endometrium. Then we have something called an HCG priming. इसमें क्या करते हैं on day 8 or day 9? These are actually mostly for the IVF cycles, where we are going to do a frozen embryo transfer. You can give 150 units of HCG daily starting from day 8 or day 9. However, if we think logically, because they are giving us better LH receptors or better HCG receptors, even if we do it in the IUI cycle, it should work. I have not used it in IUI cycle, but I think logically speaking, we can use it even in an IUI cycle. Then can we use low molecular weight heparin? Can we use steroids? Can we use IV globulins? Can we use endometrial scratch? Now, endometrial scratch, actually, the first paper by Barash in 2003. How does endometrial scratching help? So, what do we do actually in endometrial scratching? If you're doing a hysteroscopy, you place a grasper and just go from one ostia to the other ostia with the grasper. So you have just done a scratching at the fundus level. Suppose it is an IUI cycle, आपने ये cycle में cancel कर दिया because she didn't have a good endometrial lining. In the luteal phase, you can just take an IUI catheter without anesthesia, just place an IUI catheter and just scratch the endometrium left and right very gently, and that probably causes a little bit of inflammation, which will help in the implantation because it releases the growth factors, macrophages, dendritic cells, cytokines. Endometrial injury might improve the blood flow. Then we have the PRP. Now, PRP, you go to all these cosmetic centers, what they are using is PRP left, right, and center. So everywhere they are using PRP. Now, how earlier we used to prepare PRP with 8 ml of whole blood. However, we have changed our preparation now, and we have realized that we are getting better concentration of platelets. So I was in the first IVF center in Dubai, and this is how they are preparing the PRP over there. So I thought maybe I could try it over here, and when I tried here, I realized we were getting better pregnancy rates. And when I compared the concentration of PRP which we were preparing with 8 ml of blood and now with 30 ml of blood, all the patients do say that, oh my god, 30 ml of blood you have taken, we are getting a higher concentration of platelet and growth factors in this. So this is how it is created. We take 30 ml of blood, we centrifuge for 10 minutes at 1250, then we take the supernatant of all 3 vials, place it in a conical wire, again centrifuge 3500, again remove the supernatant in a vial, transfer it to a cryo vial, and then we put it in liquid nitrogen for 30 minutes, and then we thaw it, and then we use it for the PRP. Most of the times we are using it for the hysteroscopic PRP injection at the endomyometrial junction, and that is how we are preparing it. So these are all the vascular factors that are there, and just a very, very small video how we are preparing. We have an original publication for this particular procedure. This is done in the luteal phase of the previous cycle in patients with thin endometrium, especially patients where we have planned a frozen embryo transfer, which we had to cancel. We can also do it in IUI patients when we know that rest everything is fine. The only thing what we are not getting is the good endometrium. So this is how I was just recently, we have actually demonstrated it in many places. So this is an ovum pickup needle, which is going through the side channel of the hysteroscope, and this is how we have about 4 to 5 ml of PRP, and 1 to 1.5 ml is injected on each wall. So anterior wall, posterior wall, right lateral wall, and the left lateral wall. So what we do not do is do not do it at the fundus, because fundus is very thin, and if you the moment you go straight into the fundus, there is a high chance that you may perforate, or you may just go through and through. And we actually did a study for almost a year on this, and then how much to go inside, what deep depth to go. So this is a ovum pickup needle. So if we cross the 6 serrations, we did it with an abdominal ultrasound, then we are exactly at the endomyometrial junction. So this is how we are doing it. But there are many more publications, more papers coming for this PRP, and very positive results coming. So in different way also people are injecting. People are also giving small licks and leaving the PRP in the intrauterine cavity. And after the injection, very important is keep there, don't immediately come out, wait for about a few seconds, 40, 50 or 1 minute, so that it gets absorbed, and then you come out. So this is how initially when we did it, we went with the abdominal ultrasound. So we wanted to inject over here, you can see the arrow, we wanted to inject over here, and then under ultrasound guidance we injected, and we realized that that much depth of the needle should go in for the hysteroscopic PRP. So we got good results with that. And this is how the we did the installation. It was done in the luteal phase of the previous cycle. So this was our paper that we presented on thin endometrium with hysteroscopic installation. But this is only after we have tried everything. We gave vitamin E, we gave antioxidants, we gave oral estrogen, we gave GCF, intrauterine PRP. Only if all that does not work, I think, can this particular hysteroscopy, again, very, very important. If there are adhesions, if the cavity is bad Asherman's, then nothing is going to work for that particular patient. So thin endometrium, again, we need more studies, we need more Cochrane review for this particular method. And thank you very much. And if there are any questions, we can take it. Thank you so much.
Thank you, Dr. Meenu, for beautifully explaining this thin endometrium, and also telling each and everything about PRP and all this. Anybody wants to ask any questions? Is it an open forum?
No, it's not an open forum, madam. They send the questions to
Okay.
and then the questions come to us.
Mhm.
This was
Okay.
really a wonderful. Can I speak a word?
Yes, sure.
Presentation, Dr. Meenu. I also do PRP, and rather than instilling by the hysteroscopy, I do instill, as you tell, by the endometrial just installation. And on the same very cycle, on the 9th and the 11th day, and I do get very good results.
Yes, that is the first option, madam. That is the right one. The first you try GCF or PRP in the ongoing cycle. Only if that is not working, then that was the paper that we published.
Right.
Mhm.
Very good presentation.
And I think all the delegates who are listening should look at the endometrium in IUI cycle before saying कि अभी IUI cycle काम नहीं कर रहा है. So endometrium is
That
very,
is
very
very important. Very, very important.
correct, madam.
Mm.
So except PRP in IUI cycles, we are also doing all the things which you have told, madam. And definitely we get good results. Of course, PRP is one procedure which takes, more of the workup and other things. So, but your presentation was really, really, really very good. Thank you so much.
Thank you. Thank you.
Thank you. Second presentation.
Dr. Kanchan Durukar, are you there?
She's not there.
Okay, all right. So we will now have the second session. Dr. Meenakshi Deshpande, are you there? Kanchan, you are there, right?
Yes, ma'am.
But I don't have the PPT of, yeah.
Okay, no
I
problem.
have sent already, but like Dr. Meenu have introduced, I can introduce
I have your
myself.
PPT. I have your PPT. So before I introduce you, let me introduce the chairpersons here. Uh, one moment. Yeah. So we have Dr. Meenakshi Sood. उनका तो हो गया ना, हमने already introduce किया है. I don't know. She is the life member of. She is the senior consultant at Sood Hospital, Aligarh. Founder member of Sood Hospital. She is a senior consultant and she is from KGMC Lucknow. She is a life member of IMA Foxy UPCOG, ISOPAP West SCBI. President of Aligarh OBGYN Society 2023 to 2024. She is a master trainer for HPV vaccination and special interest in adolescent health and high risk obstetrics. So, Meenakshi madam, welcome and thank you for joining. And then we have Meenakshi Deshpande. Are you there? Okay, so we have the second chairperson, Dr. Professor Zehra Mohsin here. Madam, can you just introduce yourself and then we will introduce Kanchan madam. Madam, you are muted.
So good evening, madam and everybody. It's a pleasure to be with you today in the evening. I am also chairperson of the Department of OBGYN at Jawaharlal Nehru Medical College at AMU.
Okay,
So
madam.
I'm sure all of you have heard about AMU. It's a very prestigious,
very prestigious university, madam. Yes.
Yes.
Welcome.
So I'm the chairperson. So I head a whole team of consultants and junior faculty, and we have about 51 residents. So that's me. And it's a pleasure to be with you in the evening.
Welcome, Dr. Zehra.
Thank you so much. Shall I introduce Dr. Kanchan Sharma here? All right. So she has been the secretary of Kanpur OBGYN Society 21 to 23, president of IHRF Kanpur. She is an ART specialist, as we already understand from her, laparoscopic surgeon and also a colposcopist. She has had a lot of ART and embryo handling training from Netherlands and also at Rainbow IVF Center, Agra. She is recently organized a mega event, WW NetCon. You also got a Foxy Achiever Award. So many compliments and congratulations to you. She also has a Pratigya Social Impact Award, Empowered Women Award, Nari Ratna Sammelan and Corona Warrior Award, Nari Suraksha Award, and Lifetime Achievement Award from KOGS Kanpur. So very, very prestigious that we have your thing. And you are, of course, you have been the vice president and honorary joint secretary for IMA Kanpur. And she's at the moment you are the chairperson for the non-communicable disease Foxy. So and I think the last year's theme was only on non-communicable disease. So it is a need of the hour, and I welcome you to speak on this particular topic on joyful motherhood.
Thank you so much. And for a nice introduction, should I share my PPT?
Yes, please.
Meenu Agrawal, and my good wishes for your future endeavor. And thank you all the wonderful presidents and secretaries who have logged in today of the 3 societies, and myself, Dr. Kanchan Sharma, NCT Committee Chair. Today, my topic is pre-pregnancy and peripartum care for the joyful motherhood. Motherhood is a blessing. There is a joy and excitement everywhere. Whenever a patient conceives and comes to you, there is, as we have seen in many movies, as soon as the newlywed lady that comes with the news of pregnancy, there is a lot much of joy. And in movies, even you have seen that some hero comes with Nagada and all, saying that now she has conceived. The childbirth is a unique and amazing experience. Natural childbirth preparation is very important for this. Now, why to prefer the normal delivery? Why? Because it is said that it is healthier for both mother and baby. If the patient delivers normally, mother feel more confident. There is a greater connection with the body and quicker bonding. A boost to the baby's immune system is always there. So we prefer and facilitate normal delivery because it facilitates breastfeeding also, avoid major surgery, and there are lower chances of lung problems. There's a faster post-delivery recovery and shorter hospital stay. This is very important. Vaginal delivery is the natural way of the birth and is safer for the mother and the baby. The researcher says that 70% of pregnant women can have a normal vaginal delivery and only 30% they need cesarean section. For this, it's very important that we counsel our patient. Incidence of cesarean deliveries are increasing because of the following reason. As we see, there is a change in lifestyle and lack of the physical activity. So because of all this, the joyful motherhood, as we say, that situation doesn't come. There's obesity and bad dietary habits, which is increasing nowadays. We are seeing with the change of the lifestyle of the young ones, late planning of pregnancy and feeling of insecurity, as we are seeing that our kids are busy with their career settlement and all, and so they plan their pregnancy late. And there is, of course, less pain bearing capacity and negativity. Cesarean section rate, if we see, that is highest in Telangana in our country. What are the useful tips for easy labor and joyful normal delivery? We advise to our patient to focus on your diet, exercise, get enough sleep, keep yourself cheerful, and learn sleeping postures. It's very important that we should advise our patient to take the childbirth classes, as we are doing in Maa Ki Pathshala. Now the NCT committee is organizing Maa Ki Pathshala throughout the country. We are organizing some important talk and topics, and all the pregnant ladies throughout the country are joining it. iMoms app, these all are the apps which are giving training and support to our pregnant ladies. A childbirth class also relieves the pressure faced by expecting parents and helps the partner or the caretaker of the pregnant woman to be prepared for everything. They acquire knowledge by this. So patients should know about the false and the true labor pains, baby movement, and the process of passing the head through the pelvis and the cervical ripening. This is very important that ideally we should have a training classes of all these pregnant ladies. Look at these nurses teaching Gudda pelvis to group of the patients and the attendant. Ideally, because we all are the obstetrician and we want that the patient should experience a joyful labor. For this, we should make any anxiety out of the mind of our patient. So we should get courses like this, training courses. These nurses are training Gudda pelvis to our patient. And regular exercises for this is very important. Indulging in the mild exercise will not only build stamina of the patient but also keep patient active during labor. And exercises patient can try. What are the exercises? Usually we should know that, then only we can advise to our patient. Kegels exercise is very important, that make the thigh muscle stronger and help in beating the stress during the labor pain. Pelvic tilts and the cat and the cow stretches, they loosen the pelvic muscle and make the lower back more flexible, as shown in this figure. Butterfly pose. Somebody doing the yogas amongst ourselves know what is the butterfly pose. That opens up the pelvis and stretches the lower back. Squatting, that helps to open the pelvis and get her baby into the best birthing position. For these type exercise training, we all have in labor room, but this must be mandatory, that we should have these type of halls just to train our patient and have them a joyful experience. Physiotherapist may be there just to train them about the proper pregnancy specific exercises. Look at this physiotherapist training the patient about the Kegels exercise, how to relax their back. These all the ladies in this figure you can see doing group physiotherapy and exercise. They just prepare themselves for a normal delivery. Kegel exercise, that is very important. It locate the correct muscle, which are the same one you use to stop the flow of the urine. Pull up the pelvic muscles and squeeze for a count of 5 or 6 seconds. That is for the patient training. Then relax for a count of 5 or 6. 1, 2, 3, 4, 5, 6. Contract and 1, 2, 3, 4, 5, 6. Relax. Work up to a set of 10 to 15 repetitions each time and aim to do the exercise at least 3 times a day. So that strengthens the pelvic floor muscles and prevent the incontinence and prolapse even later on. These are the diagram shown for different type of Kegel muscles exercise. Again, you have to stimulate your patient for doing walking and swimming even during pregnancy, because both are highly recommended. Walking is an excellent exercise. It is a low intensity exercise, and it keeps you fit and even away from the problem of constipation, high blood pressure, and restlessness. Swimming is a very good exercise that we all can advise to our pregnant ladies if they are comfortable with it. It prevents the muscle injury, regulate heartbeat, strengthens your muscle, and keep your body fit. Antenatal yoga, it's very important. Yoga is not just a great way to healthier body, but also a mean to ease out the delivery. Some yoga poses are perfect for the pregnancy, as they help relieve lower back tension. These poses help to open up the chest, shoulder, and the hips. Therefore, we advise our patients, antenatal patients, to take yoga classes. Practice breathing techniques, even pranayam, they are also very good. These breathing exercise, they should be, as these all are teaching, breathing help women in labor to tolerate the pain and help in the relaxing her. First of all, you can breathe out, breathe in, and then breathe out, holding the your respiration. This all teaching should be done very properly by a trainer to your patient. Garbh Sanskar, now this is an upcoming branch and we all know about it. Garbh Sanskar is very good for the mother, for the baby, and for the society. For the mother to experience the joy of pregnancy and making it a memorable journey. Trouble-free and disease-free pregnancy. There is no complication. It is said and it is experienced also by many of us while we advise to our patient to ensure the natural delivery and enjoy this journey in a better way. It's also good for the baby because it causes excellent health and the good strength, even superior intelligence, it is said, and even mental strength of the baby. For the society also, this is good. So these good things are to be adopted. This is very important that you advise to keep a watch on a posture to your patient. Patient's proper posture is great, that you have to advise. These all are the wrong postures: wrong lying posture, adequate lying posture. When she lies down on one side, she should keep a pillow or a hand behind her head. This is a wrong posture of sitting. This is a right posture. Wrong posture standing, and bending is not advised. Should sit on her knees. Again, a figure of good or bad posture. This is a posture for standing. Don'ts and do's are given. These type of charts should be there in your labor room so that they will guide to your patient how to get up from your bed. This is very important that you should train to your patient. What is the adequate sleep pattern? A proper sleep position is this. This is a wrong position. What is the right position? All should be displayed in your labor room by a proper chart. You should advise to your patient that do not put on excess weight, because obesity can make it difficult to monitor the baby during the labor, making normal delivery difficult. This type of chart in your labor room will show your patient that if you are underweight, that is BMI less than 18.5, you can gain total 12 to 18 kg weight. For normal being 18.5 to 24.9, you can gain 11.5 to 16, and for overweight only 7 to 11.5, and obese 5 to 9 kg weight you can gain in the pregnancy. Patient should advise to stay hydrated. जल ही जीवन है. हम पेशेंट को बताते रहते हैं कि पानी पीते रहिए. Water is vital for the health. Labor is hard for the body, need extra water to stay hydrated. So water increases her stamina and energy. She should take fresh juices. Apart from drinking water, patient can also use it to make the labor process easier. Hydrotherapy. Hydrotherapy is very important now. Upcoming branch. Fill the bathtub with the water and soak it for relief. Also showers, bathing pools, and hot compresses should help ease pain and offer relaxation. Keep the water at the room temperature to avoid any harm to unborn baby. Advise your patient to stay away from stresses. We always say that stress that again increases your pregnancy complications. Negative emotions can turn the process of childbirth into a nightmare. So try any form of meditation, which is always advised. You always advise to a patient that read good books, listen to good music, involve in visualization technique. Company of the good and the friendly people should be do. Like in this figure, you see that by a good company, these all pregnant ladies are very happy. Effects of listening to music during pregnancy is great, because now the research shows that music promotes personality development. It improves patience and reduces stress levels, causes baby's early brain development even. Music during labor has been shown to increase the even oxytocin and the beta endorphins, which help with moving labor forward and with the pain management. Music decreases hormone catecholamines, which slow down the labor when elevated. So now you can play a very good music in your labor room and ease down patient's discomfort. Music can reduce the pain. Music during labor reduces the perception of pain through concept called the gate control theory of the pain. Body begins to perceive other stimuli less because of this, and there is a pain reduction. And even music can help pass this time, especially during the early labor. This is the effect on the fetal brain of the music that I have shown. That listening to the music, even releases dopamine in the brain. I had my one patient. She used to hear music a lot, and she delivers even while ultrasound. We can monitor. It's now research. The baby's movement. They are happy. Even on the plants, we see the effects of the music. That's good, really good. This is a picture of the labor room. Give proper support and positive vibration during the labor. This is very important for joyful labor experience. There should be a good support in labor room so that patient can feel relaxed. We advise our patient to stay mobile. Movement may smooth the labor progress and relieve the discomfort. Patient may sit on a butt ball or soak in a tub. So now we can consider the water birth. Many of the institutes, they are now shifting on the water birth. But adequate training is needed for this. During a water birth, a woman experiences labor and delivery in a tub of warm water. In the water, the body becomes buoyant and there is a release of oxytocin and pain relieving endorphin. So this method can be opted for a joyful birth experience. Stay positive and refrain from the negative birth stories. Many times, many patients of ours, they come hearing many negative stories from their friends and say, ये तो नहीं हो जाएगा, doctor, वो तो नहीं हो जाएगा. Always stay that, please stay positive and refrain yourself from the negative birth stories. Think positively and stay focused. The pain, she should know that I am feeling cannot compare to the joy that is coming. That must be her thought. So make pregnancy and labor a happy, joyful, and memorable event. That should be her thought, and we should make them understand. 4 tips for the normal delivery. Diet play very important role in keeping her healthy, thus paving the way for a natural birth. We should advise our patient that eat right. Healthy doses of fruits, vegetable, lean meat, legume, and dairy products should be taken. Choose dark green vegetable, good amount of starchy food, and food that are rich in protein should be taken. She should take iron-rich diet. Avoid eating street food as they may contain bacteria. Ideally, plate half full with fresh fruits and vegetable, 1/4 portion of the whole grain, and 1/4 portion of the lean protein should be there. Patient should include bromelain-rich food. At the start of the labor, bromelain is an enzyme that can stimulate labor and softens the cervix. Usually, you have seen that your patients come to you and asking, Madam, which fruit I can take? Can I take papaya during pregnancy? Can I take during labor? Fruits such as mango and pineapple are rich in bromelain. Consume raw bromelain-rich food for the best result during the labor. But do not consume these fruits in excess as you may go into the premature labor in the pregnancy, during the pregnancy time. Pineapple contains an enzyme known as the bromelain, which is believed to cause cervical ripening. Even cervical ripening is the first step towards the cervical dilatation, which could eventually lead to labor. It is believed that highest concentration of bromelain is present in the core of pineapple. This is again a very important step. Are we adopting it or no? We should all adopt. Perineal massage is a gentle manual stretching of the pelvic floor to prepare the muscles and skin in this area to give a stretch around the baby's head during the vaginal delivery. Our patient should be taught for it. Regular perineal massage prepare the body for the vaginal delivery. To massage the perineum, wash your hands. Lubricate and hook your thumb inside and gently pull the lower part of the vagina outwards and forwards. To prepare the body for the normal delivery, add perineal massage to routine in at least last 4 to 6 weeks of the pregnancy. What does it do? It makes tissue around this opening more flexible and resilient to pass the head of the fetus. Now exercise to stretch the perineum from 37th week. Epino is a device stretching exercise that should commence at 37 weeks and continue until the end of the pregnancy. These exercises gradually stretch the perineum in daily session of 20 minutes, comprising 4 cycles of the 5 minutes. This is a device of Epino that you see a balloon. Insert the Epino balloon halfway into the vagina and gently contract and relax the muscles against the balloon, which provide the resistance. Each day inflate and stretch more. After stretching phase, relax the pelvic muscle and allow the Epino balloon to expel itself from the vagina. That is a great suggestion to the patient. This will familiarize the patient with the sensation of delivering the baby. And we take these type of preparations, that we prepare a dummy preparations, and first we train our patients by this and then allow her to do at her home. A strong pelvic floor supports the weight of childbearing and is more resilient in its recovery after the birth. In these exercises, the balloon acts as a sensor and is only minimally inflamed. The pressure gauge monitors performance during Kegel training and tell the patient is exercising the right muscle. The stronger pelvic floor muscles, the higher is the pressure exerted on the balloon. This is called biofeedback and motivate the patient to improve her performance. These exercises. Now, Epino is easily available in India via her healthcare at home. This is Epidosin. The sponsor of today, they have Epidosin preparation, Valentamate bromide. Bromide 8 mg injection. This actually reduces the first stage labor time by approximately 5 to 6 hours in primigravida and multipara women. We were using a lot. We have used a lot of Epidosin usually for spastic cervix. It exerts anti-muscarinic as well as anticholinergic effect and relieves smooth muscle spasm. Epidosin is known to shorten the first stage of labor, thus avoiding or minimizing cervical dystocia, leading to prolonged labor. It is a potent, rapidly acting cholineolytic, spasmolytic, and musculotropic agent. So we can try Epidosin also. Summary of the tip and trick of the joyful birthing. Following is a summary of the tips for a better outcome. Stay away from stress, join antenatal classes, do regular pregnancy-specific exercises, Kegel, walking and swimming, join antenatal yoga and meditation classes, learn adequate breathing exercises, keep a watch on posture, take adequate and proper sleeping posture, stay hydrated, do not put on excess weight, take healthy, nutritious diet, remain cheerful and focused, read books, listen to music and involve in visualization technique. Remain in the company of good and friendly people, add perineal massage to the routine in the last 4 to 6 weeks of pregnancy to prepare the body for normal delivery. Remain happy and enjoy the motherhood. And following these easy tips can help in making the childbirth experience simpler for expecting parents and make the pregnancy and labor a happy, joyful, and a memorable event. Thank you very much. Look at these all animals and human beings happy with their young ones. Thank you very much. Thank you, Dr. Meenur, all the folks, POGS Society and the Aligarh Society, all the chairpersons.
Thank
Stop sharing.
Thank you. Thank you.
Thank you. Thank you. Okay.
I request Meenu ma'am, you want this?
I request Meenakshi madam to say a few words about the.
Actually, Dr. Kanchan has given a wonderful presentation, but I would like to add a few things. When a patient in pregnancy comes, I feel she should immediately be told about her journey. What journey she is going to travel, how she is going to travel. We are with you, our staff is with you, and you will have a wonderful journey and then a beautiful destination. Like, beautiful destination is the child. So first trimester, second trimester, third trimester, every trimester should be given due importance and due, investigations and advice.
By the classes, as I have shown, by the classes.
And then when the woman arrives in labor, then there should be some staff to welcome the patient. Oh, your journey is done. Now you are into your destination. And then the woman should have a very, very elegant and graceful entry to her zone where she's going to deliver. And she should have a preferred companion. I started my practice in a rural setup where, nobody knew what it is. And there used to be mother-in-laws with all the, those kind of tantrums and all, which I had to handle with great difficulty. And I used to think the woman, it's such a curse. It's not a bliss. And now when, I traveled, I made them understand that, no, it is not a curse. It is not something which you are, forcing to have. Like animals that you just give birth, forget, and leave the child. You are having 4, 5, 6. You are not able to bother about them. Slowly and slowly, I could achieve that. Now I am in urban setup, and the people who are coming from rural areas, even they are aware what to do, whom will accompany. Husbands to kahin nazar hi nahi aate the. I say husband should be the wife at the time of labor. He should also experience the pain at the same time, and he should do whatever she demands for. Whatever she demands for at that time. Your, environment in the labor room should be such, then every staff is very helpful. The pain relieving should be such by music or by injection or whatever, that she should experience the least pain. And when the child comes, everybody should celebrate and give immediately that skin to skin contact. And as you have already made her aware that you will have to breastfeed immediately, you have prepared the breast also from 36 weeks onwards. You have to tell that now it's growing and you have to feed the child whatever it is. You cannot go from the hospital without feeding your child. So these are the few things which in the joyful journey we should now add up with all these things which, we are doing for the normal delivery. Whether it's a cesarean or normal, the patient should have the faith that yes, she is totally protected and she will have a wonderful experience. These are the two things which are very necessary for a joyful motherhood.
We will call you in some माँ की पाठशाला में हम लोग यही बताते हैं. There are lot many ladies, they are pregnant ladies, and many now it is being organized by NCD committee. I will call you sometime over there just to give a talk. And yes.
तो कंचन जी, आपका नाम मुझे बहुत अच्छा लगा, माँ की पाठशाला.
माँ की पाठशाला.
She is Kanchan, and she is doing all the beautiful work in Kanpur. I've been knowing Kanchan for so long. She's doing beautiful work.
Right.
Thank you.
And it was really a very good experience to be with POGS. Thank you so much for inviting us.
Same here. I think Dr. Zehra had to leave, so.
Yeah, she's busy. She's the chairperson of the department and much work is with her.
कल्पना मैडम, आप हैं यहाँ पर? कल्पना दीक्षित मैडम? कल्पना दीक्षित मैडम, is she there? कानपुर सोसाइटी के president?
Kalpana is logged in, but I
Yeah. Okay. So
now we have to vote for Dr. Meenu and
yes, definitely.
Vijay Banana.
Yes. Definitely.
Vijay Banana.
Thank you, Dr. Kanchan. Thank you. And that was a very nice lecture. And छोटा points आपने तो जो भी cover किया आपके don't lot of come उसका ऐसा हो गया, उसका ऐसा हो गया. So don't listen to all the bad things You listen to the good things.
यूजुअली पेशेंट्स आते हैं, हम बहुत डरे हुए हैं, मेरी वाला फ्रेंड ने ये कहा, उसने ये कहा, उसने ये कहा, ऑल द नेगेटिव थिंग्स दे हैव इन देयर माइंड.
Correct. Very nice. Very focused, very nice talk, and very soothing, and with a very positive attitude. So thank you so much. Thank you.
Yes, thank you, ma'am. I would request Meenakshi madam to give the vote of thanks. Ma'am, are you there? Meenakshi ma'am?
I'm not seeing her there.
No. I think she had joined in from the PGS office. So
Yeah,
maybe,
madam has joined from phone.
yeah.
Yeah.
So Kanchan, okay. So on behalf of POGS, I am the immediate past president of Pune OBGY Society. I thank Kanpur OBGY Society. I thank Aligarh OBGY Society, and I thank the committee of non-communicable disease, Dr. Kanchan Sharma, Dr. Meenakshi Sood here, Dr. Zehra Mohsin, Dr. Kalpana Dikshit, Dr. Reshma, and also I thank the chief guest. And I think the guest of honor could not join. So Dr. Pankaj Desai, very nice story that he told.
Yes.
And Dr. Asha Bakshi, we missed her this time. So maybe she'll join. Or maybe she joined and logged out because she was busy in something else. And thank you to BSV for not
BSV.
displaying the PowerPoint today. But it's all right.
That is the most beautiful thanks.
Yes, and thank you Kanchan Durukar for doing this nice MOC for today, and of course our POGS team, Dr. Aarti Nimkar Madam, Dr. Meenakshi Deshpande, and Dr. Amol Lunkar, and Dr. Vaishali Chavan and Dr. Charu Bape, both are the course this cutting edge webinars. Actually, we named it cutting edge webinar because we every time come out with some topic which is
Something new.
recent. Yes, thank you, madam. And we are every time doing it with 2 societies, 4 to 5 every Tuesday. So that is the time for this particular thing.
Good.
So
Thank you. Thank you,
Okay.
Dr. Kanchan Durukar. You are there. And best wishes again to Dr. Meenu.
Yeah.
thank you, Dr.
From whole AOTS, from Aligarh Society, I really
Thank
convey
you.
my wishes to Dr. Meenu. And I would definitely ensure and tell Dr. Zehra also.
Thank you so much. Thank you, Meenakshi, madam. Thank you.
Can I leave now?
All right.
Thank you. Thank you.
Yes, thank you, madam. Kanchan Durukar, can you leave?
It's recording ना, तो recording अच्छा BSV से ले लेंगे.
हाँ जी, हाँ, इसका वो YouTube पे भी है उनका लिंक और रिकॉर्डिंग में. So they create a YouTube link every time.
Yes.
So please share the YouTube link with us.
Okay. Bye bye.
Okay.
Bye.